Okay, welcome back, everyone, from whether you are joining us online or here or from one of our hubs. I know Madrid is still with us. We are excited to continue the second part of today's program. I did find the first part very interesting and always very, I think it makes you happy to be part of this journey altogether. Now it's my pleasure to introduce Robert Metzke. He's the Global Head of Sustainability, and Robert will share key insights into the healthcare industry's impact on the environment. And that were also some of the questions I got, and explain why driving sustainable and equitable healthcare is at the very core of and heart of the Philips mission. Welcome, Robert.
Thank you, Anke. It's a pleasure. And that are big shoes to fill, of course. That was fireworks, so I hope you enjoyed it as much as I did.
We can still give him an applause.
Thanks. A couple of remarks that really stuck. Of course, down is where your chin is pointing. Don't forget that one. And the other one, Andre Kuiper explained also, right? If we humans are moving with 28,000 kilometers per second, per minute, per hour it was. It's 8 kilometers per second. That we are definitely out of our specs, and I think we can say something similar about the healthcare industry globally at this point in time. If you look at the impact that we are seeing, I think it was briefly referred to also by Clara earlier. The climate change has huge impact on healthcare systems. We see accumulation of of heat waves. The global average temperature last year was approaching 1.5 degrees above the baseline, which means in cities we see temperatures are 3 to 4 degrees above the long year means. We have extended heat waves that's causing expected to cause 250,000 additional dead people per 200 in 2050. So that is significant. Healthcare systems are already stretched. We see high staff turnover, burnouts, shortage of hands. So that is all an avoidable cost and additional burden to healthcare. The World Health Organization has also tried to put numbers to that in terms of dollars, 2 to 4 billion US dollars additional cost by 2030 only, where we already know that a big part of the GDP and the income in countries where we have healthcare systems is going in healthcare systems. So costs are rising, the environmental burden are extremely high, and at the same time, healthcare is also contributing to that. On global average, about 4% of the global emissions come from the healthcare systems. That is more than all airlines together, and that in the context where half of mankind doesn't even have access to healthcare. So 4 billion people do not have access to healthcare. We need to find ways to reconcile these two truths. Also, if you think about material usage, Andre Kuiper referred to the enormous amount of waste when they tried the simulation of resuscitation in a spaceship, but also here on Earth, if you look at the enormous amounts of waste that is created by a single operation. Here you see this famous picture that went viral on social media. But also on a global average, it's about nearly 30 pounds, 13 kilograms per bed per day. 10% of global resources that we dig up from Earth is going into the healthcare sector. A third of all helium resources, which we know. So this is significant. Healthcare is not just a victim of climate change, it's also contributing to it. Which means it's super important to do something. Also, especially if you think about the global trust crisis, where people have difficulties sometimes to believe what governments are telling them and so forth. I think doctors are very trusted community healthcare providers. If medical care providers are joining the climate marches, are forming an opinion, if leading care providers are around the world are formulating goals to become carbon neutral to address these issues, I think that's really radiating far beyond the healthcare sector itself. Let's look briefly, at least, in what this looks like. Actually, a big part of the emissions from the healthcare sector is outside of the walls of the hospital. Hospitals itself are very energy intensive, often the most polluting buildings in any given community, but an even bigger part of the impact is in the supply chains and out of the walls of the hospitals. It is not just patient traffic, but it's also the entire supply chains. If you think about, for instance, these big heavy medical equipment, for instance, MR scanners, and what it takes to make them, all the material that needs to come out of the earth, supply chains that span 10 tiers that go all around the world, the energy that you need to produce these, to ship these, to install these, to maintain these. So that all contributes to the enormous energy and resource intensity of the healthcare systems that we see today. Now, that's the context that we operate in as Philips. And, I strongly believe, and so do with me, I think, our 70,000 colleagues around the world, that as a leading technology provider in the field, we have a role to play, and we can, teaming up with the leading care providers in the world to do something about it. Carla already referred to it. Our purpose is to improve 2.5 billion people's lives, and we cannot do that while at the same time impacting the planet. Personal health and planetary health need to go really hand in hand. Now, this is not just a beautiful statement. It also really lives, and it lives because we break it down. And the Philips colleagues in the room will know that, of course, intimately by making it really tangible. So we have formulated midterm, long-term, and short-term goals, and really integrated deeply in the work how we operate it. The topics for us super important are making healthcare accessible. Health and well-being for all is one of the United Nations Sustainable Development Goals, and at the same time respecting the planetary boundary conditions. So being mindful about the material that we use, circular economy, and thinking about climate action. We have very specific targets on it. We were the first health technology company to commit to science-based targets for scope 1, 2, and 3. Some years back already, we have engaged with our supply chain and formulated the ambition by next year to have 50% of our global supply chain to commit to science-based targets. And it's now already 47%, I must say, which is amazing, given the fact that we have millions of people working in our supply chains and more than 15,000 companies that we source materials from. So this is really a global force, I would say, and very proud to be part of this movement. Some facts and figures for those of you interested in on the environmental and the social impact performance. So we are well on our way. At the same time, sometimes it is frustrating to see how slowly this is going. And we are one of the most sustainable companies of the world. And we have seen also from what the astronauts shared, how steep the learning course has to be and how short the time is actually that we have to make the changes as mankind. As a company, we have enormous global reach, touching nearly 2 billion people already today. So I think that also brings the responsibility. A couple of thoughts to conclude with. So I said we really integrate this thinking in how we develop strategies, how develop our product portfolio. You see a couple of examples here. We have been eco-designing since the late 1990s. As of next year, it will be mandatory for every single new product introduction. Some wonderful examples in terms of innovation coming out of that, including, for instance, the Blue Seal magnet that is operating helium-free, miniaturization of equipment, the handheld ultrasound, but also digitalization of healthcare, super important to make healthcare more accessible, using less stuff, and really also changing the way how care is delivered. I will not go into all the details. Let me just mention to you that there are different scopes of doing things. Of course, as a technology provider, we can provide energy efficient equipment to hospitals, but it's only a part of the equation. I think it's even more important to think also about the embedded carbon, so all the energy that's used to get the stuff there. So if you think about half of our supply chain already committed to carbon science-based targets, which means we have a very low carbon supply chain. We can produce in a carbon-free environment because Philips operates carbon neutral since 2020. We can deliver this equipment in a circular way and take it back or refurbish it. That all really, really reduces the embedded carbon in this equipment. And the last step, and I think that's super exciting, and we'll talk more about it with our customers also that will join us on the panel, is thinking about how to shape different care delivery models, how to optimize care pathways in the hospital, where you really see how clinical outcomes, environmental outcomes go hand in hand. Let me close with saying it is a pleasure and it's an absolute excitement also to work with the leading care providers in the world, some of which are here with us today, to really see what it looks like in practice, to explore next to the bed in the hospital setting how care can be delivered in a way that is good for the patient and good for the planet. There are some beautiful examples, Champalimaud Foundation, where we have committed to help our customers to reduce their carbon emissions with 50% in 5 years' time. We are working together, for instance, with Rennes University on cath labs and emissions. And we've been working with County Durham and Darlington, the NHS Foundation Trust, to develop a blueprint for new ICUs and waste reduction in that setting. So that's really tangible, very practical, can be replicated, can be scaled, and it's fantastic to have some of these the people in the room. Looking forward to the panel discussion. Thank you, Anke.
So thank you, Robert and Huub Paardenpatruc. There are the chairs for a panel discussion. So now it is really about sustainability healthcare in action. And as Robert already said, we're super happy that the visionary leaders and frontrunners of our customers are here with us. First, I would like to ask Clara to the stage, Clara Sattler, the head of Europe regions, to lead the upcoming panel discussion. And I would like to invite Richard Hickson from the NHS Foundation Trust UK, County Durham, Johanna Lameco from the Champalimaud Hospital, and online, somewhere in our left, there would be Anne Kittler, the CEO of Rennes University. Yes, he's not saying.
Hello, can you hear us?
Yes, we can hear you.
Okay,
but we cannot
start.
see you yet, somehow.
Yeah, so we started the camera, so yeah, not sure how we can appear. Yeah, we are connected at least.
Okay, we figure that out. I'm sure we will figure that out. And Robert, you're back also here. Have good discussions together and share a bit of your good leading examples.
Yeah, so welcome also from my side. A big thanks for being here. I think it's very clear, and you spoke about that, how partnering is important for us, and evidently for us, partnering with our customers is front row here for us. So big thanks for all the customers, both online as well as in the room, to be here. So let's hope we figure out the online situation as well as we move along. Robert, you introduced us to the impact that we have as a healthcare sector, where you said that we are responsible for about 4.4% of global emissions. So if we were a country, that would put us in the fifth largest polluter in the world. So I think that makes very clear how much the healthcare industry is in a need to actually take a leadership role in looking after our planet as much as we look after patients. So it's a really big pleasure to discuss with you what you are actually doing in your respective hospital settings. And so I would start with you, Richard, with the question whether it is time to extend the oath of do no harm beyond patients and to the planet.
Thanks, Clara. And yeah, absolutely. As a clinician, I'm very aware that the concept of first do no harm, it's underpinned medical care for centuries, if not thousands of years. But it was a concept conceived before international supply chains, container shipping, pharmaceuticals and plastics. And we now know that modern healthcare, it does cause harm to the planet, directly through its pollution and indirectly through climate change. And yet the health of absolutely everybody on the planet is completely dependent upon the health of the environment, the land, the oceans, the air that we breathe. So from my point of view, it's complete common sense that we include the planet in first do no harm. We extend the concepts because we simply don't want to be fueling our own workload. There is also a very strong moral perspective that our own healthcare should not come at the expense of others. So as a clinician, I believe all clinicians should simply have one eye on the patient and one eye on the planet.
Yeah, thank you so much. I think that is a very reasonable position. If we want to care for ourselves and the patients as well as our planet. So I would actually now move first to you, Joanna. Can you shed a bit more light on what does that mean for you, sustainable healthcare in action?
Thank you, Clara, and thank you, everyone that joined us today here in the room. I'm very happy to reconnect with some familiar faces, and also to the Madrid hub. I have to say hi as well. Wow, sustainability in healthcare in action. It sounds like a motto, doesn't it? It propels us for action. And I'm quite sure that by the end of this session, we will have this as the motto, at least for this session. So I have a small antenna here. That's why I'm turning like this, like a Teletubby. Okay. So I don't want to preach to the choir because I know we are in a room full of specialists. We all know what sustainability in healthcare means, right? But I urge you to think about this, sustainable healthcare. In your regions, in your countries, the general public, do they know what this means? Do they know what it implies? I can tell you that I did a small assessment with my family and friends, and they don't have a clue. So they don't have a clue that we are severely harming the planet while we are taking care of each other, right? So what to do, right? So for me, in a very simplistic way, when I have to try to make an effort not to be a scientist, I'm a retired scientist. What does it mean, sustainable healthcare? How do I explain this to both of my kids? So basically for me, it's just as simple as how can we treat our patients today without compromising the health of the generations to come. And this seems quite easy, right? No, it isn't. We all know that it's very complex, right? So we need to account for not only environmental responsibility, and I'm lucky because I'm talking after Andre, after Thomas, after Robert. So I'm just repeating what they said, right? So it's beyond, we need to think about beyond environmental responsibility. We need to talk about and think about and incorporate economical viability. We need to talk about social equity, right? We need to include preventative care, as Thomas mentioned, right? If we don't need to treat as many people, we don't produce as many waste. I'm sorry, I'm taking too long. Can I continue, Clara? Okay, so I'll continue. So, it's a call to action, right? That's what you asked. So what shall I do? Where do we start? Because this is so daunting, right? So what do we do? I think this is paramount. So I really love to incent new actions, but it's daunting. It's scary. You may be afraid of failing, and then you ruin the initiative, right? So I really believe that starting with the right foot is really important, okay? And it will be very different and very unique to each entity, whether you are an equipment supplier or developer, whether you are a clinical care facility in Lisbon or in Porto or in any other region in Europe, right? So I was thinking, is there anything common about these things on how to start? I think there is. And I really like the idea of talking after an astronaut that showed the planet, because I think that's the key. We need to think globally, right? And then we need to partner wisely, because sustainable healthcare is quite an endeavor, and we won't be successful if we try to do this alone. We will fail miserably. So where to start, right? Think globally, partner wisely, and then identify one concrete area to start tackling. At Champalimaud Foundation, what we did, as Robert mentioned already, was to tackle the clinical imaging department. Okay, so both radiology and nuclear medicine, both diagnostic and interventional. Once we did this, it also became quite clear that to have a successful pilot, we needed to define concrete goals. We need to align everyone on the same page, and that is the goal that was already defined, 50% reduction of carbon footprints until 2028, okay? More than this, these goals should be measurable and ideally externally verifiable. I'm sure that everyone heard about greenwashing, and this is very important to talk about, this elephant in the room. It has to be, in our perspective, externally monitored, and so we brought another entity on board to do the external auditing and to assess the baseline and then assess the benchmarking progress along the way. So once you define all these, go for it. Just go for it. And I'm sure that, I hope I'm here in 2028 saying we were successful in this pilot, we are launching a new one, okay? But I really want to believe that this is the way forward. You start in a concrete way with a pilot and be successful, and then other initiatives will ignite.
Thank you so much. I will steal one idea, which is doing private assessments in my social surroundings. So, because I love the places where actually, you know, what I do in my work environment allows me also to be a good mother, a good daughter, and a good citizen of this planet. So I will definitely steal that. I'll pass on to Anne, so I can see you now. So welcome in the room as well. So you're on the big screen. Can you say a little bit about what you consider sustainable healthcare and how you went about that journey in your environment in Rennes?
Hello to everyone, and thank you for inviting me. I am with Melissa Vincent, who is Innovation Manager at Philips and who help us on sustainability projects. So, as Robert Metzke said, we know today that climate change and pollution are major public health issues. And however, the activities of hospitals, including care, contribute to this. And it contributes very significantly, as healthcare currently represents 8% of greenhouse gas emission in France, which is a lot. So we have to reduce it by 80% by 2050 to limit global warming to 1.5 degrees, which is a real revolution that we have to do together. And healthcare must do its part. We need to continue providing care. We need to respond to the increasing health needs while also reducing our environmental footprints. So it means that we have to design another care and preventing care, as you said before. So for me, this is the definition of sustainable healthcare.
Thank you very much. So can you say something on how you started this journey in your hospital already?
Yes, of course. So we know that the main emission factors related to hospitals are linked to three elements: purchasing, as you said, also particularly medication and medical devices, and also food. Secondly, the travel of professionals and patients, and finally, energy. So I share with you three examples of what we do. For example, this year we finished the construction of a tertiary building with 100% wooden structure, solar panels, rainwater recovery for sanitation, and 100 recycled furniture. Another example is that we try to providing care with fewer consumables. So when we are doing the care, we ask us, do we really need gloves for this care? Is this exam prescription really necessary? Can I do a teleconsultation with this patient to avoid bringing them in? Do we need to change the patient bed sheets every day during their hospital stay? So this is an example of question we have to address every day with the patients. Another example is for example, for the providing electric bikes for staff to help them switch from cars. And today we have reduced 10% of car usage among employees. And of course, we have to work with industry, and industry partners as Philips are very important also to achieve this goal.
Thank you very much, and thanks a lot for the very concrete examples that you've been tackling across the three areas that you just mentioned. So now, Richard, would you let us know what you're actually doing in terms of, bringing sustainable healthcare to life in your environment?
Sure. Well, for that example, I'll turn the clock back 3 years when I was sustainability lead in my trust. So I'm a critical care consultant by background. I'm sustainability lead. Somebody rings me up and says, there's somebody from Philips who wants to speak to you. And I said, okay, well, why? And they said, well, they want to talk about sustainability. And I just thought, no, they're trying to sell us something. And anyway, I took the call. And
so thanks for that.
Yeah, no worries. Actually, I think I took the call on the second approach. So I took the call and we had a chat. And it was Aileen. She started off and said, really interested in cardiology, radiology. And I went, oh, bad luck on critical care. She didn't hang up. We carried on talking and we listened and we talked and we explored. And we suddenly realized that we had so much to learn from each other. I thought, as someone who'd been working in sustainability for several years, that I kind of had a handle on things. And suddenly there was these fresh eyes on our problems. So we convened a group, we made a plan, we thought really holistically. So we just, nothing was off the table. We talked about everything we could. So it wasn't just about decarbonisation. We really ended up with this focus on consumption, on process, on waste, pollution, and patient experience as well, which was really important. And we started delivering actions, and we started delivering actions way before we'd even finished the report out. So we started seeing all these wonderful things coming through. So one of the biggest things we did was we simply had sustainability as part of our multidisciplinary critical care huddle every single day, and we had a checklist of things that we went through. So we reminded people, don't open equipment just in case. Open it when you need it. Mm-hmm. Let's look at our intravenous administration of drugs, convert them to oral wherever possible to reduce all that waste and pollution. Let's think about patient-specific PPE. Let's think about the patient journey, when to demedicalize them, recognize that, stop doing the blood tests, remove them from the monitors, mobilize them earlier, improve their experience, stop all the alarms going off. So suddenly we had this great, really holistic plan. But also, to get to that point, we had to engage the hospital at every single level, from the trust board all the way down to the staff working on the shop floor. And you know what? What sustainability was within County Durham Trust, it was a culture. Suddenly, everyone wanted to talk about what we were doing with Philips. Everybody got it. It was just part of what they expected us to do, and there was no suspicion, and we explored areas that we never thought we would explore, and the outcomes have been fantastic. And then we've done the most important thing with those outcomes. We've communicated them. Exactly. We've looked not just internally, we've looked externally, because we have to drive change, not just within healthcare, but in every other industry across the planet. And the voice of healthcare is especially powerful. So that's, to me, what it looks like within my hospital.
Thank you so much.
I just want to come in, Richard, because what I really love is the specificity, right? So that the stuff that really happen in the day-to-day experience in hospital, and that common sense of joint ownership. And I think that's stuff that we also have seen and heard from the astronauts earlier today, right? So this common sense of ownership, being in it together, not bickering about who is wearing which flag or which logo or whatever, but trying to solve it together. Thanks.
And absolutely, and the line I absolutely love and roll out time and time again: for the climate and environmental emergency, there's no winners or losers. We all cross the line together, or nobody crosses it at all. So break down the barriers and work together.
Thanks.
Yes, thank you so much. And I think it's also a beautiful a sign of collaboration, as you said, that you work with all levels in your organization. I think that is super important to really have impact and then also communicate about that. So thanks for sharing that experience. I know that you're also really passionate about how to extend sustainability beyond the hospital and beyond hospital to other settings. So can you say a few words around that? Yeah,
well, thank you. And as I said, I think all of us as healthcare professionals can become communicators. I think every single person can communicate that what we need is a healthy planet and maintenance of good health. That is what we need. So all our healthcare professionals can communicate, who learn about this within our huddles and within our critical care unit, can communicate this outside of work. But what I was really excited about, which again, Philips catalyzed, was one of my interests was oceanic health, because the health of each and every one of us is dependent upon that of the ocean. A warm, hypoxic, acidic ocean, it's an unhappy ocean. Just like it's bad for humans, it's bad for the ocean, and it affects all life, all the way from the smallest plankton upwards. So one of the touch points for healthcare that I came across was the shipping industry. The UK is lots of islands. We have all our healthcare supplies shipped in on big container ships. So I was aware that the shipping industry had this impact globally through their emissions, about a gigaton of CO2 a year, plus an awful lot of other emissions. But we were heavily dependent on that industry. Turn off the container shipping industry and healthcare in the UK would just cease overnight. So I was aware that there were these initiatives, one of which was run by the Aspen Institute in the US, called Cargo Owners for Zero Emission Vessels. And it's an ambition statement that any organization can sign up to. So we're in one of our conversations with Philips, we're talking about the critical care unit, and I bring up COSEV. And I said, you know, is there anyone within Philips that would really like to kind of talk about oceans and shipping? And it went up to Robert eventually, and we had a chat, and Philips became the first healthcare supplier to the NHS, the first out of 80,000 who signed up to COSEV, and then went on to engage with the Zero Emission Maritime Buyers Alliance. And that was a monumental step because, you know, COSEV's not a small initiative. We've got Amazon, IKEA, Unilever, these huge companies that are part of it. And suddenly we had a healthcare supplier with the additional power of their voice saying why they were doing this. And that was just so important. The team at Aspen were just so thrilled. And then what we did with it, we ran with it. It was launched at I think it was New York Climate Change Week. And then there was a whole load of online publicity as well. So yeah, I'm very passionate with reaching outside of healthcare and driving change in other industries. And I'm extremely grateful to Philips for being those ones who stepped up to the plate.
And this illustrates a very important point, and that's this purchasing power, right? And green procurement. So if hospitals really formulate what they want, what our customers want from us in the industry, that has such a ripple effect also going through industries, through our supply chains. So thank you for formulating that question, right? Because that drives change. Yeah.
Yeah, and I think simply through the amount of consumption that we drive, it is a very powerful voice. So that is super good to hear that, and so thank you so much for sharing that. So Joanna, you, I mean, evidently we all, you know, are very passionate about sustainability, but we're all trying to do all sorts of other things as well. So could you share a little bit of light on how sustainable sits within the broad list of challenges that you face?
Right, that one is tougher, Clara. Okay, so yeah, where to start, right? If we think about healthcare systems, where should we start? For the sake of the discussion here today and the audience we have here with us, let's think more about industrialized countries. I think that if we talk about non-industrialized countries, then the scenario will be a bit worse. But in any ways, in any industrialized country, we know that there is no such thing as unlimited resources, right? This is obvious, and we are talking about the planet and also about financial constraints, time, human resources, everything, right? I can give you the example of Portugal in terms of our healthcare system. So it's daily on the news, and this is not for the best reasons, as you may imagine. So our healthcare system is currently finding it very difficult just to provide for the needs of patients today. Okay, so this has to be addressed, right? We are talking about permanently workloads on professional staff. We are talking about the need to invest in higher escalating cost treatment, the need to invest in R&D for the future, the need to invest in more modern equipment in our hospitals. So should the healthcare systems bet in sustainability? So this question arises a lot, okay? And when this question arises, what I really like to do is to talk with younger generations. I'm no longer part of the younger generation. I'm not, right? So I need to talk with my nieces, who are 14, 15 now, and they are very vocal, and they say, are you nuts? I should not talk like this in public, but yes, you have to address sustainability. They're not worried with healthcare, they are worried with the planet as a whole, right? So once we have this clear that the future generations are having this, are making this huge pressure on us, then we need to act. And again, we need to start. If we didn't start, we need to start. Where to start? We already went through that, right? But I think I would like also to add something to this apparently daunting path, the action, right? The sustainable healthcare in action. That is, beyond collaborating, also, we have explored that here. Also, try to see what others have attempted. Have they failed? Have they succeeded? You can learn from both the successful cases, the less successful cases. And there are plenty of resources out there. You just have to, if you don't know, you just start talking and networking, and you'll find all of those. After that, engage your community, as it was also talked here, from top management to your front care providers, to your patients. Don't forget about your patients. Engage them and communicate, as was already mentioned.
Mm-hmm. I think I'm also always very optimistic, right? So I truly believe that if we can have an impact on sustainability, it will also help us to address a lot of the other challenges that we are facing as a healthcare system. So do you already have like a concrete example for me on how did you deliver this priority of sustainability in a clinical setting?
Yes, so now we are partnering with Philips, right? We have talked about that several times already. This was a top management decision. But one aspect that I really like and I would like to talk about here today comes from one of the site visits that Philip held recently to our research institute and clinical care facility, part of this partnership, right? Top management decision, all in place as it should, project management, all perfect. And then I accessed this meeting. Okay, I'm more of an observer because I'm there monitoring. I'm not a physician, practicing physician. And then suddenly nurses were there. Okay, by the way, team from Philips are here in the room today and they can say whether I'm telling the truth or not. Mm-hmm. And some people from the Madrid hub as well. So the nurses were there, and based on this, they decided to run a pilot themselves on waste reduction because they simply want to do it. And Philips is helping them conceptualizing the pilot, okay? Because of course, being a bottom-up initiative, it has to have data, it has to have all the necessary metrics to be successful and to have adherence to it. So, what are they attempting? They decided to look to the medical tourniquets that are used to take blood samples or to inject the contracts. And they decided to search in the market what are the alternative solutions that may be more sustainable because they are really, really troubled. They are deeply troubled with the waste that they see based on that. So they decided to also keep that to show the waste volume. They decided to study the cost of the current solution, identify alternative solutions in the markets, and also understand the safety issues of those alternative solutions because, of course, they want to be, they want to have on their side the hospital infection control committee, not then saying, no, this is all good, more sustainable, but it can't be because we can't impact the clinical care of excellence that we provide to our patients. And if you ask me, why are they doing this? It's very simple. It's because they want to be the motor of change, okay? They are the ones saying, we want to do this, and they are doing this on top of the daily clinical care of excellence they provide to the patients, on top of that. So I'm an observer. I'm a super fan of this initiative. I'm eager to see the results and to communicate them, of course, as much as I can, and then to see this being nucleated in other teams with other entities. I really believe that these are the champions. We all have these champions in our institutions. At least this is how I call them.
Yeah, I just want to say, so I'm Kettler and Rennes smiling broadly. I don't want to put you on the spot, but I know you have done very similar things, and it's exactly bottom up, right, where nurses and care providers step up. You have been working with waste separation, and so that's the kind of things that drive change, that engage people. And what I like about the example from Joanne, it really helps to show how sustainability is not just another priority. It can unlock so many other things, right? Staff engagement, cost reduction, think about lateral improving workflows and so that is very encouraging. Thanks for sharing that.
Yeah, thank you so much. And that's what I said, right? I'm deeply positive. I hope that will help us solve other challenges and that all things will actually work together in the end, because that's where it gets really beautiful if we can address several things together. I've heard a lot about like making things visible, right? And how can you make things visible? So maybe Richard, I'd start with you again. So how do you make visible what you're doing?
I think start with the visible. That's what I would suggest. I mean, throwaway comment, but if you can find topic areas that staff can relate to for change, that is tangible, then you will get far more engagement. So when we have greener NHS with NHS England, and it's very, very much focused on decarbonisation, which can seem to staff just a little bit far off beyond switching off lights, LEDs, etc., turning off monitors when not in use, etc. But we decided, especially when we did the work with Philips, to focus very much on consumption, waste and pollution, the visible, because people get it already. Most people kind of understand it from home. People understand they want to reduce their consumption, they want to sort their waste, put it in the right bins, there's a feel-good factor to it, and that translates very quickly or very easily to what you can do at work. So again, going back to our daily huddles, we talk about consumption, reducing the use of disposable equipment. But we don't stop there. We then give concrete actions of how we can reduce our consumption, but then we also look at the processes that we are using for managing equipment that is actually labelled as single use. So for one example, intravenous giving sets for intravenous fluids. We get through hundreds of thousands every year, and they're almost used once and chucked in the bin, and then another one is put up when the next round of antibiotics is being given. Well, there was an injection port on some of them, so what we did was, instead of throwing them away, we'd disconnect them. You'd follow infection control practices, you connect them to the injection port, you'd have a closed loop, and you would use them again for the second dose, the third dose, the fourth dose, the fifth dose. So suddenly your use of virgin plastic goes down significantly and your costs go down. So you introduce these process changes, which you then explain, you then feed back, and then actually everybody's happy because you've got the feel-good factor plus you're reducing costs. When you then get to this point where an item is no longer usable in the clinical setting, then you really, really must understand your waste streams. And this, again, is something that is very visible because we do it at home. So we made a change again on our unit. We stopped using single-use sharps containers. We went to reusable, and we introduced another waste stream, a blue medicinal board-based waste stream. And we redirected all these giving sets and things which were originally classed as kind of hazardous and sharp, which they weren't. We did a risk assessment. We said they could go into these bins. We introduced this across the critical care unit. Now, this only has 11 beds, but every year we save 2.5 tons of virgin plastic. We redirect 6.5 tons to more sustainable waste streams, and we save £5,500 in costs. And these more sustainable waste streams, they don't travel 200 miles, they travel 16 miles because they can go to a municipal processing facility that creates energy from the burning of the waste. And then we feed that back to the staff, that the waste that you are putting here just goes down the road. You can almost see it from the top floor of the hospital. And the energy that we create from burning this waste goes back into the grid to power your homes. Make it visible. Do that communication, feedback, and make sure the staff feel that they are delivering change.
Any other experiences on how making things visible?
I will follow that lead. I think that, for instance, now focusing on the clinical care providers, right, that is our case. I believe sometimes we forget about the patients. In the sense that we don't forget about patients. The patients are at the center of what we do. I'm talking about the sustainability factor, right? They should be part of it. I'm pretty much sure that they want to be engaged in that. We see this over and over again. So how do we do this? How can we achieve this? Again, it's by engaging our staff. It's by empowering them. It's by mobilizing them. And patients will adhere to this. And I think the the benefit that a clinical care provider institution gets from this is priceless, because we are showing that we care about treating patients, but we also care about their families, about the future generations. So we really care. We care about their health and about the next ones that will come.
So Robert, I'll pass on to you one more time on that topic. Having just come back from New York with a heavy focus on climate and health, so what do you think is a good approach to further increase awareness?
I think we are seeing a lot of awareness. So also the WHO really has stepped up. You know, Vanessa Carey is the climate envoy of the WHO. She is doing wonderful work reaching out. There are a lot of hospitals, thousands actually, that have committed to become climate neutral globally. If you look at the last Future Health Index, the survey that we do every year, thousands of leaders around the world have understand that we need to expand this concept of do no harm and take care of the planet. What we also see, I think, is this caption between commitment and ideas and bringing it practically to action. So what I think, what we don't have the time to reinvent the wheel everywhere in every single care provider, hospital, supplier, whatsoever. So sharing, finding ways to exchange best practices, bringing people together on platforms, for instance, like Healthcare Without Harm or Team CleanMed or so, things that you do, speaking up, sharing these things. It's not about bragging. It's about helping others to catch up because we don't have the time. I think that is super, super helpful from my perspective.
Yeah, thank you so much. I think that's why this is such a great opportunity, because all of you have actually in practice done stuff and you're sharing at the moment. So thank you so much.
Maybe a quote on that, which I really like. Somebody said, the future is already here. It's just unevenly distributed. So finding these nuggets and sharing them is really helpful.
Yeah, and getting to a more even distribution.
Exactly.
If we all as good as our best practice, we'd be in much better space. Yeah. So I think that's really, really important. Thank you so much for that quote. So my last question would be, what we already had one thing questions today, so I'll ask another one thing question. So what is the one thing that everyone in this room and online can actually do to make a difference? Any suggestions on that? I've got my favorite one. I've got my one for today, actually. I might start. I think my one is today to actually start talking to people about this, because I think it starts with awareness. And I for sure haven't so far used my social surrounding to talk about this. So I think that is one that I will take away. Any other ones that you would have for the audience in the room and online?
I think from my perspective, I'm just going to reiterate a couple of things which have already come up, but I just think they're just so important. One is to respect nature and the natural systems that have existed for billions of years, doing a really, really good job. When you look at the speed of change of temperature, CO2, oceanic pH, it is just crazy at the moment. We're putting these natural systems under crazy strain and they just cannot cope. And as far as I can see, there is no tech-based solution for mitigation on the horizon. And we are going to have healthy natural systems working with us rather than us just completely destroying these natural systems. So I would just say we need to, each and every one of us, each and every company that is represented here, every healthcare system has to find ways to really respect, not just protect, but restore natural systems, because we've done an awful lot of damage up until now, and we've got a lot of damage to undo.
Thank you so much. Joanna, any input from your side?
I will try to follow Richard's lead, and I will say, and I will remind everyone that we work in an amazing sector. Healthcare, providing care, promoting health. This is amazing. So it's just obvious that we will take the next step all together. We will understand that we need to collaborate to take care of the planet as well as we take care of each other. And so I will reinforce the message, collaborate externally with other entities, I believe is the key for the future. But don't forget to look internally and identify your champions. I believe that merging these two together will wow every single one of us.
Yeah, maybe doubling down from my side on this also. Right, we are sitting literally in the same boat. On the theme of today, it's called Spaceship Earth, wonderful book from Buckminster Fuller. So I think understanding that and seeing sustainability not as something else, just at priority number 13, but really seeing in the clinical context how it makes a difference, how good care needs to be sustainable, I think that would be a way to unlock a lot of these things that we spoke about.
And you also want to chime in?
Yes. So as we see, we need a revolution, and every contribution counts for global change. So we need absolutely everyone. And at the hospital, everyone can contribute at their level. For example, if I am a cleaning agent, I can act by using fewer chemical products. If I am a pharmacist, I can act by reducing expired medications. If I am a nurse, I can act by questioning what I use daily for care for my patients. If I am a doctor, I can act by asking if a certain exam is truly necessary. If I am a secretary, a doctor, or what else, I can act by cycling to work if possible. And if I am a patient, I can demand for sustainable care. And if I am a deputy CEO, I can support each of them. I can congratulate them, and I can help them to do it. So we need everyone and everyone together. And to conclude, the hospital, the Rennes Hospital, is also very invested in preventive care, and the real key lies there: keeping people healthy rather than having to treat them as much as possible.
Thank you so much for ending on that note. I think it's something that I'm personally very passionate about, and I believe as a company we're passionate about. So I'll hand over to Anke now. I'm sure you have already managed to collect the online questions. Is that correct? And any questions that we have in the room?
Yeah, so we are starting to collect the online questions. There is room for more, so please bring them in. And also you here, if you have questions, feel also free to reach out. I go to the wrong page, I'm suddenly trying to approve certain deals, but that's not what it's about. Sorry. Sorry for that. Okay, I get different questions. I first would like to go to you, Robert, because that is more about what we as Philips are doing. And what are we as Philips doing in, and it was a very specific question because we also have the people from LATAM online, in LATAM specific, related to sustainability. And how are we supporting then our customers to be more sustainable in the LATAM region?
That's a very specific question. Thanks for that. I mean, we are a global company, so all the things that we do generally also apply to LATAM. I think that starts with developing a sustainable product portfolio, doing all these studies. I'm not aware of a specific study that we've done with a LATAM care provider, but I'm sure that's on the wish list of my team also. I see them nodding heavily. But I think generally the things that we are doing in terms of eco-designing, teaming up, making these case studies available, and so are super helpful also for the people in LATAM.
Yeah,
I hope.
So I think so too. So Robert, you bring that here. I think also the dialogues we're having here are good examples of what you can have also with your customers to trigger thoughts and ideas. I also have a very technical question where people really go into more details of healthcare practices, and Johanna, Richard, maybe one of you can answer them. That is really about the ESC practices. How can ESC practices impact patient experience and outcomes? So that is really how we translate the ESC practices to that. And how can investments in sustainability then improve the quality of care? So how can we help that to improve quality of care?
Richard, you want to approach the first part? You're a physician after all.
Yeah, you might need to explain what the acronym is, though, please. The ES.
So that is the environment.
ESG.
Oh, ESG.
so
Sorry.
ESG, yeah.
Sorry. Could you repeat the
Sorry.
question then, please?
So how can ESG practices impact patient experience and outcomes? And how can investment in sustainability improve the quality of care?
Okay, so start with the first, ESG linked with patient experience and outcomes. I think this is probably a panel in its own right, to be honest. I mean, that's a huge amount to cover. And I think that's a thread that we've just heard throughout the day. Environment, society, governance, it is all intertwined within the healthcare industry and the entire healthcare value chain. So separating out one bit and kind of saying how does that link through to patient experience and outcome is going to be very difficult to do within a few minutes. I would simply say draw upon everything you've heard today with respect to the impact of healthcare and other industries on the environment, the need for a healthy environment, the need for equity within societies, healthy societies, people maintaining their own health and being supported to do so, and having that reporting systems within your own companies to make sure that internally you are behaving and striving to be the best you can whilst reaching out externally to drive change in industries that perhaps are not healthcare linked. That will improve the health of populations, and ultimately, through the actions delivered within the hospitals, improve that patient experience that, like we are seeing within my own trust. When it comes to outcomes, well, we always have to put outcomes right, at the heart of everything we do, because we want high quality healthcare that is effective for patients. So, and that will come out of all those other changes within that whole kind of massive pathway.
So a real sequence, a pathway, yeah.
And that's a very systemic view. I just had this picture in my mind when I was visiting you guys in Champalimaud, just this beautiful garden, right? So integrating sustainability in your daily workflows does also so much to the patient experience, happiness, faster regeneration. Think about sustainable food. I'm sure, you provided the beautiful picture, Richard. There are so many practical examples that pop up in my mind.
Yeah.
Can I just add one point? Because for the second part of the question, I think that as clinical care providers, we start the other way around. That is, providing care of excellence to our patients can never change, meaning it can only improve. It can never come backwards, right? So we need to continue developing. Now, sustainability, and I'm here with Clara for that, I believe, I'm also a strong believer in that, and I know that data will show that both of us at least were right, that will have an impact in the quality of the care that we provide. Not only to those patients that we are lucky enough to be able to treat today, but also those that are in more remote regions that we cannot access, and so on and so forth. So I truly believe that when we embrace sustainable healthcare, we need to think about all the different areas that we're tackling, not only environmental responsibility, just economic viability is paramount, social equity, it's mandatory, and preventative healthcare. So if we really see this all together, then of course it will have an impact on the quality of the treatments we provide in the future.
Beautiful. It relates to another question I got, economic viability. Does environmental efficiency also translate into economic efficiency? It was said here, not viability. Or do these developments increase the cost of healthcare processes? What is your view on this?
Shall I continue?
Yes, you can.
Okay, then I'll continue. And I'm throwing things to the floor. It brings costs. There is no other way of saying this. We need to invest costs, even if it is people thinking how to improve the workflows. Those are costs that you need to quantify, right? We cannot disregard this. But this is short term. Long term, the benefits will by far compensate the costs. So in terms of economic efficiency, not viability, efficiency, I would dare to say yes, but we need to study this properly so that we fundament our assumptions with data. So the best way to do this is to start to always remember to monitor every cost you have along the way, because what you are doing, then you can use as a case study, as we were saying, to demonstrate to others the path you trailed, okay, and to prove your assumptions or hypotheses if you come from a research background, and show to the case with concrete data. Data is powerful and meaningful.
We just published a study in the United States, for instance, right, on a new generation of patient monitors, which is going to save money and millions of sheets of paper, and I think 500,000 of disposable batteries and what have you not. Or think about image quality, which allows you to avoid additional scans, which is better for the patient, better for the outcomes, better for the environment. Anyway, I think there are many beautiful examples, but I fully agree with you, John. It's about quantifying this also, getting the data out so that others have the arguments to embark on it. It's not about the cost of equipment. I think it's about the cost of care.
Yeah.
I think it's both. I think it's both. I think there are some, when you analyze processes, make changes, the example I gave with optimizing waste streams, you can reduce costs. I think also, you will be faced with decisions about new equipment that may be more expensive. It could even be down to something really simple, like a disposable face mask or something, but it's made of less harmful materials. Yep. And you have a decision to be made. You've got to go with we'll just go for cheapest, or you'll go for, we want this less harmful material for this product. But then procurement come in and they say, no, you can't have the slightly more expensive one, you've got to have the cheaper one. Well, the approach that I've used now, both with my own procurement team and also with NHS supply chain, and say, I must first do no harm. If you force me to use a piece of equipment with a high plastic content that is avoidable, if we purchase this, you are forcing me to do planetary harm and therefore human harm. That goes against everything I believe in. And I've actually used that argument locally and nationally, and it has actually worked with products being reinstated onto the NHS supply chain catalogue because they had a lower plastic content despite them being more costly.
Unbelievable. Thank you for sharing all.
Congratulations for that.
Thank you. Only took 3 months.
Well invested time.
Definitely.
I don't know, Anne, if you also would like to react a bit on this specific question.
Well, I can just take one example. For example, food is a big issue in hospital. And if we succeed to make more vegetarian food in the meal for patients, for workers, we can improve our environmental impact significantly, and we also can do reduce our costs. So we have some example where we can do good for the planet and for the financial of the hospital.
Thank you, Anna, for this very practical example. Also, yeah,
maybe last remark on it.
Yeah.
I think the challenge with more sustainable solutions is often that the benefits and the costs are not in the same hand, right? So that's the missing puzzle piece is also reimbursement and insurers. So one of the things that I was really excited about to learn when I was in New York at the Climate Week also, to hear that large US health insurance companies are really thinking about how to create new reimbursement structures that also incentivize better clinical outcomes in conjunction with better environmental, lower footprint. And I think that's also something where hospitals also can use their dialogue with reimbursement and insurance company to say, we want to move towards more sustainable models. Please help us do this by adjusting your reimbursement structures.
Oh, yeah. Fantastic. Also to hear. There must be questions in the audience here also in Amsterdam. It's super silent. That's not so Dutch.
Covered a lot of ground, of course.
Question to Richard. Thank you for working together with us. By being so close working with Philips, we are a global leader when it comes to patient monitoring. From your perspective, with your critical care background, where should we step up as the monitoring leading company?
Okay.
That's a cool
He's
one.
asking you to give us a hard time, just in case.
No, Okay, I'm going to a little bit of blue sky thinking here, because this is not something I've thought about in terms of critical care and monitoring. But there is the one thing that we have, or I have become aware of as a clinician in critical care, is just the sheer amount of noise that we have in a clinical environment. The patient monitors, the alarms, the telephones, the doors, it's just incessant noise. And if I was an ill patient in that environment, I really wonder how much that audible stimulation must actually kind of impact upon my day-to-day well-being and my experience. And I've often wondered about whether or not monitors could be used for more than just monitoring patients and providing those bleeps, and whether we could actually provide some sort of positive stimulus through the monitoring systems, where actually when they're not alarming and causing all sorts of helpful information, that they could be used to actually improve the health and the well-being of the patients who are actually being treated in that environment. So I'm just throwing that out there as a little bit of a random bit of blue sky thinking, but it has crossed my mind several times.
Thank you. I think we need to bring that across to product management. And
But I'm just drawing comparisons with the space rocket that we've just seen outside, with all the kids and things in with their VR headsets, with that experience and what that brings them in a positive way. And I'm just wondering whether or not we could replicate that with some of our patients in difficult situations.
Beautiful. This is also the kind of thinking we need, I think, here together. Another question here from the audience.
Thank you so much for your thoughtful comments so far. So when we had the pandemic, there was a hot topic of telehealth, right? And so now we're talking more about hospital at home. So with these two sort of emerging parts of how do you think about that from a sustainability perspective?
Shall I take the lead?
Yep.
Yes? Okay. So that's very close to our heart in our research institution. We try to provide to our patients the best possible conditions in the hospital setting for them when they need to be there, to be treated, to undergo surgery, to undergo chemotherapy. But there is no place like home, and that influences, right? There are studies showing this. So on the patient care part of the equation, let's put it like this. So we are working with several entities, several industrial partners, as we are working with Philips and with Greenvolt for renewable energy. We are studying remote monitoring conditions to be able to have patients recovering at home with their families as much as possible, for instance. We are taking advantage of this idea as well, of trying to have a more kind of dynamic monitoring systems, not only providing responsive parts, but to see if through the equipment we can also deliver or have some more active measures as well. Now, on the other side of the equation, it also brings financial benefits, of course. If we can have the patients staying less days in the clinical center, we can treat more patients, right? And with that, it brings economic viability once again, but also we can treat more patients as well. So it has an impact on business. So we are investing on these remote care treatments as well, more than telemedicine or as such. It's more in this setting. I think it will become the hospital of the future, in which most probably we can provide more actable access of treatment for more people.
Thank you, Johanna. Richard, also.
Thank you. Yeah, I just wanted to pick up upon the COVID reference there. I believe me, as a critical care doctor, I would have loved to have provided care at home for COVID patients, but believe me, there was a huge demand for critical care. And there are some things that are inescapable about our future. And unlike COVID, we can actually see the future a little bit with climate change. We know that even if we get to net zero tomorrow, that the temperature wherever we are when we get to net zero the temperature stays at that temperature, plus or minus about 0.3 degrees, stabilizing over about 50 years. So all the health impacts that we are predicting, such as heat-related illness, weather-related impacts, infectious diseases, food insecurity, malnutrition, these things are going to develop, progress, grow as a healthcare stressor over the next 50 years, without a doubt. And we have to be prepared for those. We are not talking about adaptation enough. And we are going to see massive pressures on healthcare systems, which means healthcare at home is going to have to grow as well in order to accommodate the fact that we are just going to see a large number of people presenting to hospitals with illnesses that perhaps within Northwest Europe, etc., we just haven't seen for many years. Some of the infectious diseases which are spreading that are now coming up through Southern Europe, we are going to see as new stressors to a system. And COVID, at its worst, I think it caused 3 million excess deaths in 2020. The numbers of millions of potential deaths from these climate-related stressors make COVID look like a walk in the park. So we've got to be prepared. There's a lot of planning that needs to be done, and we're not talking about it enough.
Thank you, Richard.
Yeah, maybe just one comment. I think what is also important, and Joanna, you kind of mentioned it, is to really not forget the access of care to care aspect, because I think remote will be key in driving that agenda. I think we've heard it as well from you, Robert, that evidently there's still a lot of people that do not have access to care. So if we want to onboard them, I think it will be super key to figure out how we can do that without bringing them to care, but bringing care to them.
4 billion. And by digitalizing care and making it remotely accessible and comparing the footprint in a home setting versus a hospital setting, you also can get part of your answer in terms of environmental footprint. Right, the most environmentally friendly hospital is the one that we don't need to build.
Mm-hmm. Thank you, really super. I got a signal that we have to end this conversation. I would like to thank Anne also, and Robert, Johanna, Richard and Clara for sharing all your experience and how you bring really sustainability into action. I feel humble and really grateful to have been able to be your host here. It was at many moments really beyond inspiring. The things you do all together here, I think is like the astronauts, you enter new spaces and you help us actually to drive together towards this sustainable healthcare. And I think it's super important. And thank you for that. And thank you for leading here the path forward. For that, I really would like to thank you. Yeah, that makes, I think, us at the end of this session today. I did find it super inspiring to have this learning session together about sustainability. I also heard it from you, Richard, from you, Johanna, also from Anne, from Robert. I think it also starts with communication, teaming up, learning from each other. And I think one of the things I also remember, it's not just respecting what is going on, as you phrased it, Richard, but it's really acting and addressing what is going on. And I think this is a community we're building here together, today here, but also virtual and with all the hubs there. And I would like and hope that we will have many more of these learning events together, because this is really what we have to do in a healthcare space, as Philips, as a company, but also together with all of you that really are in the daily reality of healthcare. So really looking forward to many more of these learning sessions and to get inspired and to together really address it, not respect what is going on. Thank you so much.
Thank you very much.
So